Hello friends, myself Dr. Love Krishna Pal Singh Rathod, Assistant Professor Shalyatantra GA. Today we are discussing about the basic of scrotum diseases. This is the blood supply of scrotum, external pudendal artery, internal pudendal artery, deep external pudendal artery. Venous drainage is through testicular vein, and nerve supply of scrotum is anterior. 1/3 part is supplied by ilioinguinal nerve and genital branch of genitofemoral nerve. Posterior 2/3 is posterior scrotal branch of pudendal nerve and perineal branch of posterior cutaneous nerve of thigh. Dartos muscle supplied by sympathetic nerve. Lymphatic drainage is through superficial inguinal lymph nodes. This blood, venous supply, nerve supply, this all are important in the surgical treatment of scrotum. Okay, that's why I am sharing this in front. Now, the first which we are discussing about the case is about pyocele. What do you mean by pyocele? It is collection of pus in the layers of tunica vaginalis. It can occur in previously normal tunica or in a pre-existing hematocele or hydrocele which gets infected. Now the features of pyocele: fever, toxicity, tender swelling in the scrotum with scrotal wall edema. Often in young individuals, it may be difficult to differentiate this from the torsion of testes. Pus under tension eventually causes infective thrombosis of testicular vessels, leading to non-viability of the underlying testes or testicular gangrene. This is the CT image of pyocele. Okay, see the capsule of scrotum filled with pus. This is the case of testicular torsion with pus formation, and this is the clinical feature of pyocele, and there is the normal anatomy of scrotum with the testes is also present. This is the extracted picture of pyocele. Now the differential diagnosis of pyocele is with hydrocele, hematocele, spermatocele, varicocele, tumors of testes, filariasis of scrotum, and cyst of epididymis, which we can see further in our slides. First, hydrocele. It is abnormal collection of fluid between the two layers of tunica vaginalis of testes. Symptoms: swelling, slight amount of discomfort or pain. Local examination: position often unilateral, maybe bilateral. Inspection: one side or both the sides of the scrotum are enlarged with a notch at the middle of the affected side of the scrotum. This is quite characteristic. Fluctuation test is positive as it is a cystic swelling. The cyst is often tense in primary hydrocele, secondary hydrocele when the swelling is lax. These are the tests which are showing for hydrocele. First one is hydrocele for transillumination test, and second, get above the swelling is possible in case of hydrocele, and third one is also hydrocele showing the transillumination. It may be negative in long standing hydrocele, thick sac, thick dartos, thick skin and infected fluid, or it may be chylocele. Okay, this is the picture showing massive hydrocele wherein penis is buried completely within the hydrocele area. This picture I took from the book SRB. Now the second disease is varicocele. Varicocele means varicosity of the veins of the spermatic cord. The veins become dilated, elongated and tortuous. The veins of the spermatic cord include the pampiniform plexus, that is testicular veins, and the cremastic veins. It is idiopathic, may be due to absence or incompetent valve adjunction of left testicular vein and left renal vein, causing insufficient drainage of the blood. Other reason due to perpendicular entry of left testicular vein into left renal vein. Left-sided renal cell carcinoma tumor proliferate into left renal vein and blocks entry of left testicular vein, causing varicocele. Left side, which is irreducible. It causes increased temperature which depresses spermatogenesis and causes infertility. These are the pictures which show the varicosity of left-sided of scrotum. The clinical photo of left-sided varicocele, it looks like bag of worms. The important point is bag of worms. It looks like bag of worms. Anatomy of testicular veins: left testicular vein join into left renal vein in perpendicular fashion. Right vein join IVC directly. It commonly seen in young adult, more frequent and more troublesome in hot climate. Tall, thin men are more often affected than short and fat individual. Symptoms: small and symptomless varicocele occur in 1/4 of normal men. When vein becomes large, may cause non-definite dragging sensation and aching pain. Pain becomes worse on prolonged standing or exertion. Few patients may present with subjective bilateral varicocele can cause oligospermia. Local examination. Always examine in standing posture as it disappears as the patient lies down. Inspection dilated veins and impulse on cuffing. Scrotum on affected side, hands lower than normal. Palpation feels like bag of worms. Impulse on cuffing can be felt distinctly, but this is thrill-like. After occluding superficial inguinal ring with thumb, if patient is asked to stand up, varicocele feels from below. Bow sign. After holding varicocele between thumb and finger, patient instructed to bow down. This will minimize tension within the veins. In long-standing cases, concerned testes become smaller and softer than its fellow of opposite side. Now second is a spermatocele. This is acquired condition. It is a unilocular retention cyst formed in the epididymis, derived retention of a portion of a sperm conducting duct of the epididymis. Such a cyst contains fluid resembling barley water containing spermatozoa. Clinical features: patient present with a scrotal swelling which is usually small. Occasionally the swelling may be big enough to make the feel that he possesses 3 testicles. The swelling is situated in the head of the epididymis, above and behind the body of the testes. The clinical feature: testes can be felt separate from the swelling. The cyst is soft. Clinical feature: cyst of epididymis which is tense. Fluctuation test is difficult to elicit but is usually positive. Trans-illumination test is negative. The fluid within the cyst resembles barley water which is revealed on aspiration. This is the picture of spermatocele. Spermatocele occurs behind and above the testes. It is unilocular, containing barley-like fluid. Hematocele. Recent hematocele. It is due to rupture of one of the vessels in the tunica causing bleeding into the side. Often it may occur following aspiration of hydrocele. It may be precipitated by trauma also. Clinical features: sudden onset of pain and swelling after an history of trauma. It is tender, warm, fluctuant but non-transilluminate. Chronic hematocele. It is usually due to slow, spontaneous hemorrhage into the tunica vaginalis without any proper history of trauma. It is painless, hard, non-tender, non-fluctuant, often calcified swelling with a loss of testicular sensation. Because of the constant pressure, testicular function and so testicular sensation is lost. Cyst of epididymis. Even though it is of congenital origin, it occurs in middle age. It is tensely cystic, contains clear fluid. It is situated behind the body of testes. Inspection often bilateral. Palpation: they feel like bunch of tiny grapes situated behind the body of testes. Fluctuation is difficult to elicit. Trans-illumination tests: brilliantly translucent but are finely tessellated due to presence of numerous septa, giving an appearance of Chinese lantern. The content of cyst is crystal clear fluid which will be evident on aspiration. This is the picture of cyst of epididymis. See, the multiple cysts are present. Thank you.